Okay, so now we're going to start talking about the upper limb, okay, and the pectoral girdle. Okay, now the pectoral girdle serves as the point of attachment for the humerus or the arm itself, okay, and there are two bones that make up the pectoral girdle, scapula and your clavicle, okay. Now your scapula and your clavicle both form and join together, and then your humerus inserts within your scapula, okay, as you can see in this illustration here. Okay, so we have the clavicle itself, and then this is the scapula. Now, the clavicle can be viewed from two different perspectives, okay. You have the sternal end of the clavicle, which means this is the side that attaches to the sternum, and then you have the acromial end, the portion that attaches to the acromion process of the scapula itself, okay. And then the scapula, there's quite a few important landmarks to know and understand of the scapula. Now let's kind of get our bearings straight with this first. All right. Now I'm looking at this from the anterior view, the front. Okay. I'm looking at this from the posterior. You can see that there are two distinct landmark differences by looking at this. Okay. If you, just to avoid any confusion about the views of the scapula, if you can see the full body of the spine in the acromion process, you're looking at it from the back. You're looking at the posterior side, okay? And always remember that the glenoid cavity of the scapula, or the area where the humerus articulates with the scapula, always faces to the outside, or the lateral portion of the shoulder, okay? So now let's talk about the important anatomical landmarks on the anterior portion of the scapula, then we'll go to the posterior side. First we have the glenoid cavity, then we have the medial border, okay, and there are many muscles that work on your shoulder that originate and insert within the medial border of the scapula here, okay, and the glenoid cavity again is where the humerus actually articulates. Then you have a little bump down here called the infraglenoid tubercle, and there's a little bump up here called the supraglenoid tubercle. Those are little bumps, again, they're just serve as points of attachment for muscles. And on the anterior side you have this little bony structure called the coracoid process. Again, another point of attachment for various muscles of the arm. Okay. Then you have the superior angle, okay, the upper portion of the body of the scapula. You have the inferior angle, and then you have what's called the subscapular fossa. Now a fossa again is a flattened kind of smooth surface, and this is the area where the subscapular muscle is sitting, okay? Now, if we rotate this over to the posterior side, we can see, again, many of the same landmarks. You can see a little bit of the coracoid process. Okay, you see the glenoid cavity, the infra and supraglenoid tubercles, superior angle, inferior angle, but now you see a structure that you couldn't quite see from the front, something called the spine of the scapula. And again, the spine serves as a point of attachment for various muscles that work on the shoulder. And then you have the acromion process as well, okay? And the acromion process is where this is where the clavicle and the shoulder blade or the scapula actually meet. Okay? That's why this is called the acromial end of the clavicle. Alright? Now there are two more fossa or flattened surfaces of the scapula. You have the infraspinous fossa, infra meaning below, spinous meaning below the spine. Okay? And then you have the supraspinous fossa. Okay? And there are two muscles that sit right in these areas. Supraspinatus, infraspinatus. Two out of the, those are two muscles of the rotator cuff. And the subscapularis is another muscle of the rotator cuff. And then we have the teres minor, the fourth muscle of the rotator cuff, or of your sits group it's called. Okay? And then on the very lateral portion or the medial portion, of the scapula, you have what's called the medial border, or also the vertebral border, because this is the portion of your scapula that faces towards your vertebral column. And I apologize, I mistakenly earlier called this the medial border, when in all reality this is actually the lateral border of the scapula. So my apologies on that, folks. Okay, so these are the major bony landmarks of the scapula that I want you to know. Okay, now if we take a look at the humerus, or the bone of your arm, okay, this is important to know. So first we have a rounded head. Okay, this is the portion that articulates with the glenoid cavity of the scapula. Okay, and then you can see really close to the head there are these two bumpy landmarks called tubercles. Okay, you have the lesser tubercle and the greater tubercle. And then in between we have what's called the intertrabecular groove, or what's most commonly called the bicipital groove, because the tendon from the bicep femoris muscle travels right through here. Okay, and then you have what's called the neck of the humerus, and then you have the anatomical neck, and then this area is an imaginary line, which is what we call the surgical neck. It's called that because there are many breaks that occur here. Okay, and then we have the shaft of the humerus, and then we go down to the lower portion of the humerus, down by the elbow joint, and on the anterior side we can see a few different landmarks. Okay, first we have your medial epicondyle, and this is often nicknamed your funny bone. Okay, and it's called that because the ulnar nerve passes right underneath here, and then if you bump it, you get these weird tingly feelings. Okay, and you get those because you slam into the ulnar nerve. Okay, and then you have what's called the trochlea. This is a curvature on the medial portion of your elbow, and then you have the capitulum, kind of like an hourglass figure on the lateral portion. And then this little bump that you see right here is the lateral epicondyle. Okay, and then just above these areas there are these little ridges called the medial and lateral supracondylar ridges. Now let's break down the terminology for that. Obviously medial means towards the middle or inside, or towards your midline of your body. Okay, supra meaning above, condylar meaning condyle. So this is a ridge that's above the epicondyles of your humerus. Okay, and basically these are points of attachment for various muscles. Okay, now if we were to take a look at the posterior aspect of the humerus, again you can see the head, you can see a good portion of the greater tubercle, shaft, and then on the posterior side you see this cavity called the olecranon fossa. Okay, now the olecranon fossa is an area where a bone of your ulna called the olecranon process inserts right in there, and then that forms the bulk of your elbow joint. Well, it is your elbow joint, I should say. Okay, so then you can create movement. This is, you have a hinge joint right here, create movement. Okay, so these are the bony landmarks of the humerus. Now let's talk about the radius and the ulna. Okay, now first with the ulna, again we have the olecranon, okay, because this is the portion that inserts in the humerus in the olecranon fossa. Alright, and then we have this little bump called the ulnar tuberosity. We have the shaft of the ulna, and then we have what's called the medial styloid process. The medial styloid process. Okay, and then you can palpate that on your wrist. That's this little bony bump right here on your wrist. Okay, so this is an area where some of your carpal bones are going to be resting in. Okay, so that's the ulna, and then the radius. Okay, now the radius, you have a head, you have the radial tuberosity. Okay, this is where your bicep femoris muscle inserts. And then you have your lateral styloid process. So that would be this bony, bumpy landmark right there. Okay, and then if we take a look at this whole arm and forearm put together, you can see all these landmarks. Okay, you can see the tubercles on the anterior side, intertrabecular groove, anatomical neck, surgical neck, head, the shaft, trochlea, capitulum, medial supracondylar ridge, lateral supracondylar ridge, lateral epicondyle, medial epicondyle, aka funny bone. You have the olecranon, inserting into the olecranon fossa. You have the ulnar tuberosity, shaft of the ulna. This down here in the distal portion of the ulna would be actually the head of the ulna, and then the medial styloid process. And then on the radius, you can see the head, the radial tuberosity, shaft of the radius, and then the lateral styloid process. Okay? And then you can see you have a wide variety of carpal bones within your hand. Then you have metacarpals, and then phalanges. Okay? And this is the upper extremity that I want you to know.